You're listening to Cancer Convos with Brady and Stacy.
Hey there, welcome to another edition of Cancer Convos, sponsored by Chelsea Smith Cosmetics and the Bismarck Cancer Center. I'm Bob Brady.
I'm Stacy Sturm.
And I'm Kim Thomas.
There you go. See? It's different having a third person. Like, what is going?
I love it.
If we have like a morning zoo, we go through the whole crew, and the show would be over. I'm Stan the monkey.
I was gonna say we don't go by regular names. If you're in the morning zoo, I'd be like, I'm Spacey Stacy.
Exactly. Walk,
Yeah.
walk. Hang on. Ready?
Yeah.
Hold on.
Okay.
All right, there you go. There's your. I did a bell just because why not? Cancer Convos. Kim, how are you? How are things?
I'm good. I'm good.
So Kim is a guest because obviously she had cancer, and I didn't realize that you've been in remission for so long. So I told her, when I saw her post the other day, I'm like, oh my God, we need to talk to Kim because we have had so much loss and sadness and devastation that I feel like we need to give people hope. So I'm like, let's bring Kim in and she can share her story of her battle and how she beat it, and hopefully give other people some hope too. So Kim, tell us a little bit about your story.
Well, so I don't know if you'd call it remission as much as it's just gone. So,
Yeah.
Which is good. So you want me to start at the beginning, like how it was found?
Yeah.
So 2014, probably October, I went in just for my annual exam, blood work, the normal thing that all of us human beings should do.
Yes.
And my nurse practitioner found that my alkaline level was slightly elevated, which I found out later is not really a big deal because you could have had a beer or Advil or whatever the night before will elevate your alkaline slightly. But for me, it wasn't normal. So a month later, now November, go back in, still elevated. So she decided to do a ultrasound, and that ultrasound detected a grapefruit size tumor in my liver. So we fast forward, we do a biopsy, like the 23rd of December, and on January 2nd, she called me of 2015 and said, it's cancer. Wow. You have hepatocellular carcinoma, which is cancer of the liver. So I went to a surgeon here and he said, I won't touch it. It's too big. You need to go to Mayo.
That's exactly what happened to me too. This is like mine, word for word. Ultrasound. They're like, nope, not messing with this. You got to hit the deck. Yeah.
Yeah, you have to go to Mayo. And, and I've known this surgeon here I'd known him for years. So it's like, okay, off we go to Mayo. So got an appointment at Mayo the following Wednesday, and on that Friday, January 16th of 2015, I was on a table, and I have about a 10-inch incision across my abdomen, and they removed 73% of my liver.
Wow.
And if I wouldn't have been diligent, and this is why I always preach, just go get your blood work done. Yeah. The doctor at Mayo told me if you wouldn't have come back in 6 to 12 weeks, your liver would have shot the cancer everywhere, and you'd have been dead. So go get your blood work done.
Were you having any kind of symptoms?
No. And I should have had extreme abdominal or back pain.
Yeah.
But I kind of have back pain all the time. And so I have bad knees, so you kind of always have back pain. But he said it should have been extreme. And I didn't. And the growth was very large. So.
Do you just have a high tolerance for pain?
I don't know.
Obviously,
I guess. I certainly didn't after they filleted me open, but
yeah. Well, I'm sure that back pain masked what was going on in the liver. So it's like, okay, this is nothing. And then you go in and find that out. Like, holy crap.
Yeah.
Wow.
Yeah, it was scary, but it was in my brain. I had cancer for 2 weeks. Because it was basically the 2nd to the 16th, and I could not have radiation or chemotherapy because there was only 27% of the liver left.
Oh.
You can live with 20. So they gave me a little, 7.
A little wiggle room?
Yeah, just
little
a little
wiggle room.
And so they couldn't do radiation or chemo, but he was very confident because in his words, he goes, I took every organ out of your body except for your heart and lungs. So I looked at all of it.
Mhm.
And um and he said, I see nothing. So it was close it all back up, and in 8 weeks, in 3 days actually, my liver would start to regrow. If it didn't, they have one injection they can do. Other than that, it's pretty much lights out. But
Wow.
it's about a 5% chance that would happen. And obviously it all worked out for the best. And then within 8 weeks, the liver is fully grown to where your body needs it.
That's crazy. That
And
quick. I did
that
not
quick.
think it would regenerate that quick.
Yeah, it was a very
Wow.
trying 8 weeks, because every time I would eat, my core body temperature would drop about 2 degrees, simply for the fact that the liver's trying to grow and process food
Mm-hmm.
and do all the things. And it's like, well, this isn't fun. So we're going to take away some energy from you.
Yeah.
And it was January in North Dakota.
Oh, yeah. You need all the energy you can get. That's
Yeah.
I had my surgery December 1st, and it was like, oh, when you have to, like, when your body wants to contract.
Yeah.
And it's like, oh, this hurts so much
Yeah.
to do that. But so have you had any issues, any side effects, any problems since then?
No, and they removed my gallbladder also, which everyone says, yeah, you're going to have some issues with that, because that was it was, a casualty of the surgery.
Yeah.
And the only issue I had was they nicked my diaphragm in the liver surgery. And in December of that same year, I woke up one night and I felt like maybe a bowel blockage. It was just like I had to go to the bathroom, but I couldn't.
Mhm.
Well, the pain got so bad, I ended up at the emergency room to find out that I had a diaphragmatic hernia, which is similar to a hiatal hernia, only up in your diaphragm. And I had about a softball-sized portion of my stomach in my chest cavity against my heart.
Wow.
So then I had emergency surgery to pull that back down.
God.
But
Oh, that tiny little
yeah,
side effect. That tiny
that
little
little
issue.
side effect.
You'll be
Yes.
fine. Yeah.
Yeah, it's no problem. But other than that, no, I really haven't had. And I was going every 3 months for MRIs. And then, of course, as Stacy knows, they get spread out and spread out.
Yeah.
So now we're at once a year. Every October, I have blood work done and MRI done. And yeah, so
And
far,
nothing
so good.
since. Yeah, good. Yeah, it's 8 years of
9 years. Yeah.
9 years. Yeah, that's a bunch of crap. Yeah, it sucks. Especially that tired part of it. Like we always talk about that before. Like you just get so sluggish and tired because you're not doing anything. Your body just says, "Yeah, we need you to relax and calm down."
Right.
And you want to go, 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 but your body says, "No, you're gonna do nothing," and it just
Yeah.
sucks.
Yeah. On the days when just taking a shower was enough.
Yeah. You're like, who
Yeah.
got that accomplished today?
Yeah.
Check. Gonna
Right,
take
yeah.
a little nap.
Let me go
now.
back to bed. Exactly. Right back to bed
Yeah.
again. Yeah.
Yeah, I have clean underwear on. Good.
Good.
But now Kim has the same issue that I have too, which is like scar tissue from surgery. So we are constantly battling that, which is why it was like, I should talk to her about that too on Cancer Convos, because I know a lot of people who've had these highly invasive surgeries, these crazy surgeries where they basically open you up like an autopsy and dig around in there. You're usually left with scar tissue that just wreaks havoc on everything. And it's painful. Like it
Yeah.
hurts.
Mm-hmm.
Yeah.
And my scar tissue goes from the resection site. So the cut off part of the liver goes up and attaches itself to where the biopsy was done, which is right under my right rib cage. And then it attaches to the ribs. And it feels like when you were a kid and you ran too hard and you got a side ache. That's kind of what it feels like.
Yeah.
So about every 2 to 3 months, I go in and I have dry needling done and myofascial release, and it tears that scar tissue apart. Other than I have no feeling on the bottom half of my stomach from where the surgery was, but I mean, the needles are not a big deal. But getting that broken apart has really made a huge difference. And I highly recommend it to anybody who has any type of scar tissue, because it's amazing. Even what it's done for the look of the scar has really even mellowed out just because of that dry needling.
Yeah.
Any tips for people, like besides the blood work, but going through it at the end of it when it's all done, the rest and everything?
The rest is you know, when you're tired, sleep. When your
Yeah.
body needs sleep, sleep. Slow down. You don't have to be superhuman. Eat a decent diet and drink water. And as much as I hated them, stay diligent with your pain meds until you can get to the Advil, Tylenol stage.
Mhm.
But boy, getting behind, you might think those first few days that, oh yeah, I got this. But boy, when you get behind, let me tell you, it's a tough road to get back on top of it.
Yeah.
Mm.
Yeah.
Well, God love you for being here. It's awesome because, like Stacey said, we've had some really bad news the last couple of weeks, and it's just not.
I know.
Yeah.
Yeah.
Oof. I mean, it happens, right? Like you're not immortal, but just to have
Right.
people that you're so close to for so long, they're just passing on. It's like, holy crap, how old am I?
When you
But
got your
yeah,
diagnosis, Kim, what did you think? What were your thoughts when you first got your diagnosis? Did they do that whole thing with where they're like, we see that you have a tumor, but you don't know if it's cancerous or not. It could be benign. And you're like, no, it's cancer. Gigantic tumor
No,
like that.
you know,
So when they said it's cancer, what were your thoughts?
well, thankful, I'd been seeing Rhonda Jolliffe and she's
That's,
amazing.
yep.
And she actually, and if you're watching this, Rhonda, sorry, but she actually called me crying because that's just the type of person she
Yep.
is. And my first thought was, holy crap, what are we going to do now? Because my both parents died of cancer. I've had multiple people in my family have had cancer. And it was like, now what do you do? What's the next step? And, thankfully Rhonda handed me off to, the people that needed to see me. And, we kind of went from there. But the first thought that goes through your mind is, what am I going to do now?
Mhm.
It's like, I don't have time for this was pretty much the first thing I thought of. But then it's like, okay, well, you're going to make time or you're not going to have any time left. So,
Yeah.
that's what we always
Yeah.
say. That's the tagline of the show is cancer is a word, not a sentence. Because when I found out I had cancer, I fell to the floor and started crying because once you hear it, you're like, oh my God, I'm done. Because that's what you think. It's just cancer's a killer, right? Like that's what it is. But just to get through that, like you said, I don't have time for this. This is something I don't have time to have cancer. I have
right.
other things going on.
Yeah,
And
exactly.
Yeah,
and
my
God bless
first
Rhonda for helping you out too. That's awesome.
Yeah.
Yeah, Rhonda she was one of the first people I called to when I was diagnosed. And I'm like, I know that like I have to go through the conventional medicines, but she was really great at helping me out with other things that I
Hmm.
could do to like get some extra energy or restore some energy or, feel a little bit better or things to help with nausea, should I get it? And so, yeah, so she was great. But I do remember my first thought was, how am I going to tell my kids and my family about this? Because everybody does think when you're diagnosed with cancer, you're probably going to die. And so
Hmm.
I'm like, oh, great. And then my second thought was same thing. I don't have time for this. What am I going to do with the radio station? Like, shit. I'm going to have somebody come in and put programs in. Am I going to be able to record? Like, what's going to,
I got to go to work.
I don't have time
Yeah,
for this.
right.
I got to pay
Yeah.
my bills.
Oh, it's so funny how our brains are so trained to just be not thinking of ourselves. It's just everything else except
Yeah.
what's inside. Which you're right. Kim, you're right. Go there, get your blood work, get your whatever the doctor says, do something, do it. I'm a full-fledged believer in if the doctor says do this, when? Let's go. Because
Right.
Yeah.
they're there to help,
Yeah,
You hope,
exactly. Yeah,
Fingers crossed,
right.
knock on wood. Yeah.
And if I said this 1,000 times, I'll say it again. Medicine is a practice, and they're practicing on you. So just because it worked for Kim doesn't mean it works for Stacy or works for me. It's just they'll figure it
Right.
out.
Yeah.
Yeah.
Yeah. And I was a fortunate one, thankfully. So, and not so many people are, and I mean, it's life, I guess, but
Yeah,
yeah,
it sucks.
it,
It is.
yeah,
Life, but it sucks, especially when they say you have a grapefruit-sized tumor anywhere. Like, holy shit, that's a
right.
big
But
tumor.
especially on your liver. So now I have to ask you, when you told people you were diagnosed, you had cancer of your liver, was their first question, do you drink?
Yes.
Yeah.
Yeah.
Yes. And
Yeah.
I actually asked, I said, I grew up in a little town. We started going to parties at 14.
Yeah.
Yeah.
And and that was kind of I don't necessarily, I don't think I got asked that a lot, but you automatically think that's what people are thinking. But
Yeah.
I asked the surgeon, I said, could this have anything to do with alcohol? And he goes, no, the rest of your liver was perfect. He said there's no sign of any of that.
Wow.
He goes, for you, it was the luck of the draw. And if it wasn't if it was when, simply because losing both parents, and again, other family members having cancer. My brother had the best tip because he had thyroid cancer when he was in his 30s. And he
So
goes,
your brother had cancer too.
Mhm.
Oh my
and a
gosh.
dentist found his.
Oh my
When they
God.
do the little lymph node thing,
Yep.
he found a little lump. But he said the positive side of this is you will never have to wonder again because you will be watched constantly.
Yeah,
It's true.
it's true.
So,
Yeah.
Yeah.
just because, I had a doctor say, well, you hit 5 years, we could go every other year with MRIs and blood work. I'm like, no, nope.
No.
No,
Not with the history.
no,
the family
that's like
history the way
saying
it
I'll
is.
go every third time I drive my car, I don't need to wear a seatbelt. Like,
Correct.
Yeah.
It's
No.
true. Because
No.
so that they say that because they don't. How do I put this? They think that they may be wasting your time you coming in,
right,
and they're so
exactly.
busy, right? Like you get there at 9 o'clock for a 9:15 appointment. You're not going back till 10 o'clock. Well, I'm so busy, but in the end, yeah, I'll come there every 2 months if I have to, just to make sure I'm
Yeah.
healthy. Yeah,
Right.
whatever you need to give me. Yeah.
Yeah,
Yeah.
exactly.
Absolutely.
Yeah.
Yeah, that's kind of
Well,
they're talking about taking me off my meds this spring. Because it's been 2 years. I'm like, it's only been 2 years. Let's not high five and congratulate each other yet.
Yeah.
Let's keep me on
We
my
did
safety
it!
net.
We did
Yeah,
it.
I'm not really feeling
No.
that confident yet. But now, are you like, funny story? So last night, for the last week, I've had a pain in my arm and in my shoulder. And of course, when you've gone through cancer, your immediate thought is, oh my God,
Yeah.
this has not gone away. I thought this was going to go away. What if I have bone cancer? It's going to spread. I'm going to die within like months. I'm going to be that cancer story, like I beat ovarian cancer. And no, it turns out.
Oh God.
So last night, Mike was practicing guitar. So I was just scrolling TikTok. And when I got done, it was a long session too. I'm not going to lie. I even got that little notification that's like, you should take a break from scrolling. You might have
Oh
been
my
scrolling
God.
too much. Yeah. So I'm like, okay, I probably should take a break from scrolling. So I got up and I'm like, oh my God. It's not cancer. I've been scrolling TikTok.
You got TikTok arm.
I've been scrolling TikTok too much. That's why it's not going away, because I keep
Yeah.
scrolling TikTok at night. So it's a repetitive injury. I'm not going to die of cancer. So I jumped up and I told Mike, I'm like, I'm not going to die of cancer. And he goes, wow, okay. I didn't think you were. I thought you were okay. I said, no, I was like 90% positive that my cancer came back in my shoulder and I was going to have a very fast and quick death from cancer. But it turns out I'm just scrolling TikTok too much.
That's
Yep.
Cancer Convos, another great episode of Cancer Convos. Sponsored by Chelsea Smith Cosmetics and the Bismarck Cancer
Oh.
Center. Why would you not want to sponsor this show?
Yeah, it's a blast. It's a
Yeah.
good time.
TikTok
Yeah.
arm. That's next on Cancer Convos. Kim, thank you so much. God bless you and good luck with everything. And good to see you again.
Yeah, great to see you too, Bob.